U.S., access to COVID-19 vaccination is based on money. From Los Angeles, we bring you the following report from Eleoa Oracem, our correspondent for Brazil de Fato.
Although effective against the novel coronavirus, the vaccines distributed in the United States have a side effect: the deepening of social inequality in the healthcare system. According to Stat News, the distribution of available doses is linked to people's income. In the richest areas of the country, the immunization rate is higher. To understand the dimension of this abyss, we can look at the situation in California, the most populated and richest state in the country. There, people in the richest areas are vaccinated 56% faster than those in the poorest regions.
Where we can see that areas that have higher levels of this social vulnerability currently are experiencing higher levels of COVID infections, hospitalizations, and deaths. And so what we want to see in this next phase of the pandemic is, could we use those data to target areas that have that higher social vulnerability, have higher levels of COVID? Those are the areas we need to especially focus on for vaccine distribution.
Beyond income, the administration of vaccine doses is also a racial issue. According to an Associated Press survey, the African American, Hispanic, and indigenous population of the United States suffers mortality rates 3 times higher than that of the white population. Vaccination does not follow this logic, however, and in states such as North Carolina, where white people make up 68% of the population, they make up 82% of those vaccinated.
We are prioritizing health workers, but we are not worried about the person of color who are having the low-paid job within the health worker. He is losing or she is losing the line in the vaccine. So we need to be mindful of those things. We need to be mindful that people of minorities may suffer from chronic condition because of multiple reasons. So we need to reach out to them. We need to have campaigns to reach out to them.
Although the pandemic has shown the disparity in access to healthcare, this inequality existed before the arrival of the novel coronavirus, and the only cure is to remedy the problem at its roots.
I think it really starts with what people call the social determinants of health, and that's often described as where you're born, live, work, and play. And so from the very moment an individual is born, they're born into a set of social circumstances. And so in settings, for example, the US, where there's a lot of societal or structural inequities, those paths look very different from how early childhood education or being raised, to what opportunities there are, to what food access. Many things really diverge early on. When I see someone in the hospital, I think they've come in with this condition. Where did that really start?
However, in the case of the current pandemic, experts warn that efforts must be global, not focused in a single place.
And I wanted to send this message very clear and very loud, that rich countries need to pay attention to poor countries and put money into helping lower income, middle income countries to expedite the rollout of the vaccinations. We need globalization in here. Insulation is not the solution. I mean, solving just the problem for country A, high income country, will not solve the situation, because trade will still open, movement of people will still open. So at the global level, countries have to put money to reduce these disparities.
Bloomberg estimates that at the current rate, it will take up to 7 years for the world to be immunized against COVID-19, taking into account that 75% of the world population would need to be vaccinated.